Hello guys. So continuing my presentations for the internal medicine and specifically about the MRCP examination. So I'm going to discuss about the few topics which are important for your MRCP MCQs as well as answering the questions in your Viva for MRCP basis. So today I'm going to pick the topic of primary biliary cholangitis, and this is a new name, and previously it was known as primary biliary cirrhosis. So it will be a very brief presentation, about 5 minutes, but it will answer all the questions related to the primary biliary cholangitis, which help you in your MCQs as well as in the Viva. So let's start the things. So primary biliary cholangitis, previously referred to as primary biliary cirrhosis. This is a chronic liver disorder, and typically it is seen in middle-aged females, and female to male ratio of 9:1. The etiology of this disease is not fully understood, but they say that maybe it because of the autoimmune condition. So interlobular bile ducts becomes damaged by a chronic inflammatory process, causing progressive cholestasis, which may eventually progress to cirrhosis. And the classic presentations is itching in a middle-aged woman. And this is, you have to look for this buzzword. Normally the questions will ask about a young woman coming to the clinic and she's complaining of intractable pruritus. Some of the associations with primary biliary cholangitis, it is associated with Sjogren's syndrome, which is seen about 80% of the patients. Other associations include rheumatoid arthritis, systemic sclerosis, and thyroid disease. So all other autoimmune diseases are also associated with primary biliary cholangitis. Let's talk a bit about the clinical features. So maybe it can be asymptomatic, just picked up on the raised alkaline phosphatase on routine LFTs, or it may present with fatigue or pruritus. Mainly it is an cholestatic jaundice. Hyperpigmentation, especially over pressure points, which is a skin manifestation, and around 10% of the patient, they may present with the right upper quadrant pain. There may be xanthelismas or xanthomata. Patient may present with hepatosplenomegaly, there may be clubbing, and later obviously it can progress to liver failure. How will you diagnose the primary biliary cholangitis? For this one, the investigation of choice is antimitochondrial antibodies, and we'll particularly looking for the M2 subtype, which is present in 98% of patients, and these are highly specific. Smooth muscle antibodies in about 30% of the patient, and IgM will be raised. So there will be many questions which usually ask about most specific tests for the primary, and remember this is antimitochondrial antibodies, and these are almost in question 99% they are present in primary biliary cholangitis. Let's talk a bit about the management. Well, the first line treatment is ursodeoxycholic acid, and it does slow disease progression and improve the symptoms. For pruritus, we have cholestyramine, which gives some symptomatic relief. Patient may need some fat-soluble vitamin supplements, and mainly the treatment is supportive, but there is an option of liver transplantation, and there are specific conditions where we consider the liver transplantation in case of primary biliary cholangitis, like if bilirubin is more than 100, and this is a major indication. There can be a recurrence in the graft, but usually not a major problem. So finally, coming to the complications of primary biliary cholangitis, it can cause cirrhosis, which can lead to complications like portal hypertension, eventually patient ending up with ascites and variceal hemorrhage, osteomalacia and osteoporosis, and very important, must remember this, there is significantly increased risk of hepatocellular carcinoma, and the risk is quite high. It's 20-fold increased risk. Okay, so hopefully this will give you some idea about the primary sclerosing cholangitis, and I'll see you in my next presentation. Thanks a lot.